You are in the room, your cat is curled on the windowsill, and that low, vibrating sound begins, a gentle rumble under the chest that somehow feels like comfort, like a tiny engine of contentment. We call it purring, and most of us assume it is a simple sign of happiness. That is true sometimes, but purring is more complicated and more interesting than that. Today we will explore why cats purr, the surprising reasons behind that vibration, and what different kinds of purrs can actually tell you about your cat. Stay with me, and later I will describe one kind of purr that can mean your cat needs medical help. Purring begins early. Kittens purr while they nurse to help the mother find them and to signal that everything is all right. That soft sound is both a call and a comfort. Over time the mechanism becomes a versatile tool. Adult cats use purring in a range of contexts, sometimes when they are relaxed and sometimes when they are uneasy. The first thing to understand is that purring is both social and physiological. It is a sound made by vibration, yes, but also a behavior that humans and cats use to communicate and to regulate internal states. Listen to a cat that purrs while kneading on your lap. That purr often carries warmth and trust. Now imagine a different scene, a cat in a clinic, purring while being examined, or an injured cat purring while curled in a dark corner. That purr is not simply happiness. It can be pain relief, self-soothing, or an appeal for help. The same motor produces very different messages depending on the context. Your job is to learn to read that context. There is a mechanical side to it. Purring arises from rhythmic contractions of the laryngeal muscles that cause the vocal folds to separate and vibrate during both inhalation and exhalation. That is why purring is continuous and different from meowing. But the why matters even more than the how. One useful way to think about purring is to separate the common uses into three broad categories: social bonding, self-calming, and physiologic healing. Each of these categories helps explain why the same gentle sound shows up in so many different situations. First, social bonding. Cats purr to communicate safety and affiliation to their mother and to other cats, and later to humans. A purring cat on your lap is often reinforcing social connection. The sound is low frequency and soothing. It invites closeness. It is small, persistent reassurance: I am here, I trust you, all is well. That is the purring you want to hear when you are relaxing together in the evening. Second, self-calming. Cats use purring as a way to reduce stress and anxiety. The vibration is internally regulating. Humans hum to calm ourselves, babies suck their thumbs, and cats purr. When a cat faces an uncertain or uncomfortable situation, purring can reduce tension. That is why you may hear purring during a vet visit or after a scare. It is not necessarily a sign the cat is content, it may be a way to manage distress. Third, physiologic healing. This is the surprising part: purring frequencies overlap with a range that promotes tissue repair. The frequencies produced in purring commonly sit between around 25 and 150 Hz. Scientific studies of vibration and healing show that those frequencies can stimulate bone growth, reduce pain, and speed tissue repair in various animals. Cats may be using purring to help their bodies mend. When a cat is injured or ill, purring may be a kind of built-in therapy. That may sound remarkable, but it helps explain why injured or weak cats sometimes purr persistently. Now a short, practical test you can try at home: notice when your cat purrs and what else is happening. Is the cat relaxed, kneading, and dozing? That is likely social purring. Is the cat in an unfamiliar place, tense, or being handled? That purr may be self-soothing. Is the cat showing other signs of illness while purring, such as loss of appetite or lethargy? then the purr could be part of a healing response, but it also might be masking pain. Paying attention to the full picture matters. There are also social subtleties. Some cats use a low, continuous purr as background noise in a calm interaction. Other cats add intermittent chirps or soliciting sounds to their purr when they want something from you, like food or attention. In some cases, cats combine purring with a distinctive solicitation call that humans find hard to ignore. That is not accidental. Domestic cats have learned that certain vocal patterns are effective with human caregivers. Purring can be part of a manipulative strategy in the sense that it creates a pleasant atmosphere while the cat requests a resource. Breed and individual history shape purring too. Some breeds and some personalities are more likely to purr frequently. Kittens that were handled a lot by humans tend to purr more as adults in social contexts. Older cats sometimes purr less because of changes in their bodies or in how they handle stress. Observing patterns across time gives you a baseline for what is normal for your cat. That baseline is crucial when you encounter ambiguous purring. If a usually quiet cat suddenly purrs in a new and insistent way, take note. If a purr appears alongside changes in appetite, mobility, elimination, or behavior, those are red flags that warrant a vet visit. Do not assume purring equals comfort in every case. Later on I will name a specific purring pattern you should not ignore. There is also a physical comfort component in human-cat interaction. The rhythmic vibration of a purr transmits through the lap in a way that can lower human stress and blood pressure. Many of us have felt calmer after spending a few minutes with a purring cat. That mutual regulation likely reinforced the human-cat bond over centuries. Both species benefit. Now consider purring across different contexts. Nursing kittens purr. A cat in a sunny window purrs while resting. A dog may purr like sound near a bone, that is different. In the clinic, purring may be an adaptive response to stress. In the aftermath of surgery or injury, purring may be a low-cost way the cat stimulates its own tissues to heal. All these uses exist simultaneously. Purring is multifunctional. Here is a small experiment to help you differentiate comfort purrs from stress purrs. Over a week, take 2 quick notes each time you notice purring. What is the cat doing physically? What is the environment like? And what other signals are present? For example, purring while kneading and eyes half closed, purring at the vet while ears are flattened, purring while hiding after a loud thunderstorm. With those notes you will see clusters. Comfort purrs will group with relaxed posture and safe contexts. Stress purrs will cluster with elevated heart rate, flattened ears, or avoidance. That pattern recognition will make you a better reader of your cat. Now a practical tip for helping a purring cat that seems anxious: combine gentle voice, a steady presence, and short interactive play. The play provides a different physiological outlet, while your calm presence provides social reassurance. Avoid trying to force interaction with a cat that is purring because of pain. Instead, offer gentle encouragement and if in doubt, contact your vet. I promised a specific warning sign. Here it is: a persistent, continuous purr that is new for your cat and that accompanies reduced appetite, visible discomfort when touched, or changes in elimination often signals an underlying medical issue. That pattern can mean pain, infection, or systemic illness. If you hear that new, insistent purr and notice other changes, call your veterinarian. Early intervention makes a measurable difference in outcomes. There are fascinating cultural notes as well. In some human communities, people interpret purring as a clear sign of happiness and build rituals around it. In other communities, purring is read more cautiously. Cats have adapted to human responses, refining the contexts in which they purr to maximize comfort and care. That co-evolutionary story is part of what makes the human-cat relationship so rich. Another surprising application is intentional purring training. Some owners can encourage purring as a signal for calm behavior by pairing quiet purring moments with rewards and gentle touch. That takes subtlety. Do not force purring, create conditions that promote relaxed vocalization and then reinforce it. Over time, your cat may purr more often in positive situations, which strengthens your bond. A few quick, practical actions to use tonight. If your cat purrs while seeking food, try delaying feeding for a short pause and then provide food as a calm reward to reinforce patience. If your cat purrs at the vet or in a stress situation, note the posture and consult your vet about pain or anxiety management. If your cat purrs after an injury, monitor appetite and elimination closely and seek advice if anything changes. Now I will ask you to pay attention to one detail. Next time your cat purrs, notice whether the purr stops when you stop touching the cat or whether it persists. A purr that persists when left alone may be physiologic or healing-oriented. A purr that begins and ends with contact is likely social. Observing that simple difference gives you immediate insight. To recap, purring is a multifaceted behavior. It is social bonding, emotional regulation, and a possible internal therapy all at once. It evolved from kitten calls, shaped by human interaction, and refined by individual experience. If you listen carefully and watch the full context, you will understand more than you thought possible from that quiet rumble. Remember the warning sign: a new, persistent purr coupled with physical changes requires veterinary attention. If you enjoyed this look at purring and want to explore more about how cats communicate, check our previous video about cat vocalizations. Why do cats meow? For deeper behavior guides and step-by-step fixes, explore our playlist of cat behavior videos. Now tell us in the comments, when does your cat purr the most, and what do you think it means? Your observations help other owners learn to listen better.